NHI is a scary and complex concept, and I think not everyone understands what it really means. So I'm going to try and simplify what NHI really is. I will miss some of the nuances, but I do think the simplicity is important to explain what it is and what its implications are for the hospitals. Interestingly enough, my conclusion will be that the hospitals will probably be the most resilient part of the economy should NHI actually be implemented. I'll take you through some of my thinking. If we start with what is the current landscape, sometimes before we get to what NHI is, what have we actually got in South Africa currently? Most of us know this, but I do think it is important to set the base. At the moment, anyone in the country can go to a government hospital and get help. At the moment, if you have money, you can also buy a medical aid, and then you can go to a private hospital. They are very separate, but you have the ability to go to a public hospital, which means actually we already have some form of national health insurance or universal health. The problem is you don't get the care you need generally when you go to a public hospital. So what is this proposed NHI? I think, as I said, it is quite scary, but when you break it down, in simplicity, you are going to have the healthcare procured and funded through the government. What that means is there will be no longer any medical aids. You will procure all of the government will procure all of the healthcare, and they will funnel it through the GPs of the country. The GPs will then allocate the people either to a public hospital or a private hospital. The problem is the medical schemes will not play a role and therefore not be able to oversee the outcome of care. And I think that is quite a big risk for NHI. One of the biggest risks, and obviously why NHI will probably take a very long time, is it needs more than 200 billion, and that's a very conservative number, to bring the public hospitals up to the requirement. And as of now, actually the public hospitals will struggle to get the certificates needed to actually service the people coming to the public hospitals under NHI. Another huge issue is that the gatekeepers, which are the GPs, are in the wrong places. There's been a big court case around reallocating these GPs to the areas of need, which actually was won, and now the government cannot allocate GPs against their will, which is a big hindrance to the NHI. And then also, obviously, it will take a very long time. Conservatively, without any court challenges, it will be more than 6 years before NHI is established. So, importantly, private hospitals still have a big role to play in the national health insurance, which I think people do forget. Obviously, one of the biggest risks is that they contract at an unfavorable rate, which does scare away some doctors. I think that is a bigger issue for the country as a whole. I think you've got to think through some of the amendments that can take place that will make NHI maybe more sustainable, not particularly perfect, but I think acceptable. What you need to do is you need to see the medical aids be reestablished, that you can, over and above, take out a medical aid if you choose not to be in the net with the government in the NHI. The other important thing is you need to live within your funding requirements. Right now, the government has a really great pipe dream, but we know that the tax take can't take it because there will have to be a substantial tax increase to fund the intended 200 billion rand investment required. So we think that just accepting that you live within your means on a reduced amount of funding is one of the key criteria, and also accept that this isn't going to be a 6-year journey, but actually it will be more like a 15-year journey. Importantly, as I said, the medical aids are the custodians that make sure that the hospitals behave. We do see that as important, but also importantly, you need to allow an independent board to uphold the public hospital outcomes. So with those few tweaks, I do think that that will be a slightly more sustainable outcome. Importantly, once again, in this scenario, the private hospitals continue to play a role. In fact, they benefit from both being a service provider to the government, but also providing over and above healthcare to the medical aids. Something that's building in meetings that are happening between government and the private sector is a proposal by HASA. HASA is the Hospitals Association of South Africa. They're proposing something slightly alternate to the NHI, and it's more like the first example and the current outcome that we have. At the moment, where the public will be serviced by the public hospitals and the private sector that take out a medical aid will be serviced by the private sector. Why it works and why it is a really sustainable model that we really are in favor of is that what happens is the government will, the government will mandate medical aid insurance for all formerly employed people. This will double the amount of medically insured people that enter the net on the medical insurance. Importantly, that's more healthy participants, which makes the medical scheme much bigger and healthier, which means that they're able to fund more people in the private sector. At the end of the day, that takes out people from the public sector. So the public sector has the same amount of funding, but with reduced amount of people to look after. I think it's a win-win, almost like the private sector participating in the education segment, which takes some pressure off the public sector and can enable more people to be in the private sector. Importantly, this is the bull case for the hospital groups in that there are double the amount of people and there are way more ways to monetize those people. And importantly, the care will also increase both from the private sector and from the public sector. So I think this is a really interesting angle that is gaining traction in the market at this moment. I'm just going to have a sip of water with my croaky voice. Turning to the actual hospitals and what that actually means, I used an example which is Netcare. And obviously, based on all of the examples that I said, they are going to be quite delayed in the NHI implementation, no matter if it happens or not. Importantly, Netcare, as an example, the bed occupancy rate has increased substantially back to the long-term average. That means that it is not a company, and almost like Wim was saying, it's a company that doesn't need the GNU to really work to a certain extent because we haven't built in that big a revenue growth. So the revenue growth is there and thereabouts of 5%, which isn't really that interesting on its own. The difference is, though, that Netcare has been investing significant amounts of money in its infrastructure and its IT systems. You can see that almost just over 100 million rand has been invested, which is the red line in the bottom left-hand corner. As you can see that, sorry, the blue line. As you can see, the blue line has peaked out and they've spent all they need to spend on the IT, but the red line is the benefit that they're going to achieve from being much more efficient in servicing the patients inside a Netcare. That translates into a much higher EBITDA margin, which is important because it translates into almost 16% earnings growth, which is the top left-hand corner. So with 5% revenue growth, very solid cost containment, and also that benefit from the IT system, you can see significant earnings growth. At the same time, as Wim said, importantly, the free cash is also very good, almost yielding 9% free cash in the 2025 year. We've just separated for the dividend in red being paid out and the excess cash that stays within the business. Because of all the risks that people perceive but don't really understand with NHI, the current multiple of Netcare is less than a 10 PE. That is a really cheap valuation for that type of earnings growth, and the balance sheet on the other side, which is the last slide, which is improving every time. Importantly, the long-term average PE is significantly higher. We see no reason why it can't get back to the long-term average. All of that together, yes, there are risks. Yes, there are perceived risks. There are complexities around NHI. Importantly, the private sector hospitals will continue to play a role no matter what in any of those scenarios. There is absolutely more risk to the medical aids, as I showed you, because there are some scenarios that they do bypass the medical aids. So we think that the opportunity remains in the hospitals, notwithstanding the NHI. The valuations are good, the balance sheets are healing, and there's good free cash flow and earnings growth to come.
Okay, next, so you spoke about the fact that NHI might take some time to be worked out in terms of what sort of form it'll eventually take. Now, we know the market doesn't like uncertainty, so that's part of the reason why valuations are low for these businesses. Won't that negative sentiment continue to weigh on valuations for businesses like this?
Yeah, I think it's almost a similar question that you asked Ishrath. I think one of the key things that at Foord we really care about is what is fundamentally the business we're buying? What are the earnings and the free cash flows that we're going to get? And then we also think about the price we pay. All of those are boxes that we tick for Netcare. The one thing that we know is there will continue to be uncertainty, which means it doesn't look like there's a prospect for a near-term re-rating in the PE. But if you have 16% earnings growth compound for the next 5 years, you have a good free cash flow and a balance sheet that's really good, actually what happens is management take advantage of it. So Netcare have spent almost R1 billion over the last year, bought back almost 6% of the company at 20% below the current share price. So I think importantly, you buy those kind of companies because they will deliver for you no matter if the PE changes or not. So for us, it's a company that doesn't need the rating to change for it to perform very well.